Hi, I'm a patient care tech with Lakes Foot and Ankle Associates. Today we're going to show you how to apply a TriLok bracing system. Your TriLok brace will come with several key components in the box. The first is the actual neoprene brace itself, white medial and lateral strapping device, and a long black finishing strap. Your patient care tech will measure you for the appropriate size brace based off of your shoe size. Some patients may actually measure slightly above or below their actual shoe size depending on the size of their ankle. Once you have the appropriate size device, you'll open it up until all of your straps are fitted to the side of the device to make application easier. There are two main straps that are attached to the device and an actual sleeve that your foot fits within. Once everything's open, we'll slide the device over the midfoot and then back up over the heel so that it sits securely on the foot. The next step in application is to ensure that the brace is tight. So we're going to do that by tensioning over the felt strap that's attached to the opposite side of the device. So at a 45 degree angle, I will tension the felt upward and secure it to the side of the leg so that it's tucked in neatly beside the device and the leg. The next step is to fasten the most strap to make sure that the device is secure and does not slip down along your leg. Next, we'll go to the next top strap and Velcro that in place so that the device fits snugly on your foot. You always want to ensure that the device is snug so that there is no slippage. Your doctor will also inform you which way they want you to stabilize your foot. In this case, we're going to be stabilizing for a lateral ankle issue. So with our white strap, we'll open it up, and at the end, you'll notice a tab. One side of the tab is white, the other side is black. The easiest way to remember how to apply this strap is that you're always going to apply the black side to the top black section of your brace. To stabilize the outer ankle, or sometimes even with fascial issues, we'll adhere the tab to the brace, tension the strap, bring the strap down and back toward the heel, wrap it up above the midfoot like so, and then do a final strapping back to the side of the leg. Before I pull this strap into place, I'm going to make sure that my patient's foot is tensioned to 90 degrees. So you can do this by buttressing up your foot to the end of your couch, a wall, or your bed to make sure that your foot stays at 90 degrees. And then you're just going to gently adhere the strap to the side of the leg. Try to make sure that the strap is to the middle of your leg as much as possible. This will ensure that the device stays tight while you complete the rest of the application. With the long black strap, we're going to open it up so that the two butterfly clips inside are visible. This then attaches to the back of the device just above the heel in the middle of the brace. Because I'm strapping for lateral or outside ankle stability, I'm going to take the opposite strap, wrap it over the midfoot and ankle, and back down around the heel before bringing it back up to the inside and again going to the middle of the leg. Lastly, I'll do the same thing with the outside strap. Again, crisscrossing over the midfoot, wrapping to the back of the heel and coming back up the side of the brace. Once my straps are complete, the only other closure I need to ensure is in place is the top strap that flips down along the back of the leg and straps forward to completely secure the application. If, for example, you have a condition that requires medial or inside ankle or foot stabilization, you would repeat all of these steps. However, the step in this for the center strap would be the opposite. We would point the strap toward the inside of the foot and wrap the same way. If I'm tensioning for medial support, I'm going to adhere the strap at the top of the foot, pointing toward the inside of the area. Bring the foot up to 90 degrees again. Tension it back toward the heel. Wrap around my midfoot. Come back around. And then come right up to the center of the leg again. And then we would continue with our outside strap. And then finish off with the inside strap, crisscrossing through the midfoot. And again, we would bring the brace down and finish off the closure. It's best to try to wear the TriLok with a sock underneath, and through repeated use throughout the day, you may need to retension the brace by the end of the day. Depending on how active you are, the Velcro can occasionally slip. The TriLok brace is a hand wash only item. And if you have any questions about how either of our podiatrists recommend that you use the product, feel free to call our office at 248-360-3888. We'd be more than happy to make sure that your brace is correctly fitted and that you're using it in the appropriate manner. Thank you for watching our YouTube video. If you have any questions or comments, you can leave those down below. Don't forget to like and share these videos if you find any of this information helpful. Thank you.